rather overly generous introduction, but it really is my honor to be here, and I thank Randall and everyone here for the invitation to speak to you. What Randall asked me to talk about is, basically to make some comments on what I see happening at a national level, particularly where the fields of computer science and healthcare, learning health systems come together. So the story that I'm going to tell in a nutshell is pretty simple. Over the last 10 or 15, 20 years, we've seen twin revolutions in the field of computer science and its applications in cyber-physical systems and in big data. And these are enormously consequential changes. Cyber-physical systems technology integrates discrete computing with control of continuously varying physical devices. The theoretical underpinnings of this are the integration of logic and traditional kind of control theory physics. And the sorts of things that you can now do with cyber-physical systems are incredible. So at the risk of kind of switching between screens here, I just wanted to very quickly show you one medical application. So this is a a robot for image-guided spinal surgery. And this robot weighs, I don't know, 300, 400, 500 kilograms. It's moving around in real time. Its motions are incredibly precise, which is needed in order to build very high-resolution images in real time. And what this thing enables this team of surgeons to do, among other things, is to place the screws in the spine exactly where they need to go to have a maximally stable spinal surgical outcome. So that's one example of a broad array of cyber-physical systems technologies that are coming down the pike. That robot you can think of as one node in an enormous Internet of Things that are coming down the road. And if you think that EMRs contain big data today, wait until the Internet of Things is sending high-velocity streams of all kinds of data in real time into your organizations. It's going to be a completely new situation. Big data is the other huge revolution that's happening now. It's the integration essentially of computer science, statistics, and applied mathematics. And the computer science part of it is absolutely crucial. Jeff Dean and his team at Google really launched this revolution in many ways with their invention of map-reduced computing, which enabled them to run hundreds of thousands of computers in parallel on large sets of data to produce insights in a reasonable period of time. The main thesis of this talk, though, is that these two revolutions don't get us all the way there. They're not enough. Neither closes the loop with human and social systems. So if you think about it, we have big data to knowledge, but then what? We have cyber-physical systems, but what about the people? What about the institutions, the organizations? Cyber-social learning systems is the concept that I want to put on the table today, and my claim will be that this nascent, kind of envisioned new discipline of cyber-social learning systems will close the loop between cyber-physical infrastructure, which is producing lots of data and reacting to commands and moving things around and so on and so forth, and big data. Cyber-social learning systems will take all of that and close the loop with human and social systems and their behaviors. A learning health system or learning health systems will be cyber-social learning systems. And I was enormously impressed to learn about what Randall has done in his lab, which is a small example of a kind of learning health system. You have telemetry coming from bedside monitors, going through analytics, leading to validated predictive models, and then a kind of a clever and insightful way of feeding the insights from that data back to a professional workforce in ways that allow that workforce over time to learn to do better, yielding, in the case of Randall and his lab, improvements in morbidity and mortality outcomes that were quite significant. So in this talk, I'm just going to kind of sketch this notion of cyber-social learning systems, where the status of this idea is today, and where we're taking it going forward. So I'm going to start with cyber-physical systems, and computer scientists often talk fast, and I'm going to have to talk a little bit fast. So bear with me. I'm going to talk about cyber-physical systems, then a little bit about big data, then the rest of the talk will be about extending beyond these two revolutions to this one in cyber-social learning systems. So cyber-physical systems are based on control theory, right? Computers gather data from a system, sensors produce that data, send it to a controller. The controller can see what the system is doing. The controller has a model of the system and knows what it should be doing. It can compute a compensatory action and dispatch that action back into the system to keep it on track. Okay? So these robots, they have actuators, sensors that tell you where they are, where they should be, motors, and so on and so forth. And this is just a huge field. The key concept, though, and a problem, is that cyber-physical systems are all about physical systems. They're all about robots, machines, swarms of drones, smart canes, Fitbits, all of this stuff. It's all about the machinery and improving the functionality and performance of machines. It's not about people, right? But the principles are there. It's a feedback control kind of concept. You combine data from sensors with a validated model of what the system should be doing in order to guide the system along a path that causes it to produce the desired behaviors. And we are seeing major revolutions in systems technology because of this, including things like these surgical robots, which are really quite incredible. These concepts are also being applied to management of software infrastructures. So there's a whole field within computer science that has to do with doing for software systems what cyber-physical systems do for robots. In other words, you monitor the software, you understand its current state, how well it's serving in its given environment, and you adaptively plan out and execute changes in the configuration of the software. So here we have this notion of self-adaptive software systems, self-adaptive physical systems, all based on sensing technologies, control theory, machine learning, and these sorts of things. At the same time, we have obviously this huge revolution in big data to knowledge. Ed Lazowska calls it computing on the output of reality. I just love that phrase because what it says is just, forget about monitoring a few little things. Just imagine you can sense everything, okay? I mean, in principle, you can sense emotions, you can sense physiology, you can sense chemistry, you can sense light, you can sense sound, vibration, social interactions, key clicks on a keyboard. It's just data eventually, and we can now compute on all of that. So as we look forward 10, 20 years, think about just, you want to be able to gather telemetry on some phenomenon, it's probably going to be possible. We've made tremendous progress in big data computing. And just yesterday, the Obama administration released its strategic plan for big data R&D going forward with the following sort of bullet points just in brief. Foundations, techniques, and technologies for big data computing, trustworthiness of data, we've heard about that today, research cyber infrastructure, think Google scale infrastructure, globally distributed, replicated databases with trillions or quadrillions of records in them with trillions of interactions a day. That's the scale that we're seeing in industry today. And you can just imagine where that goes going forward. Policies to promote data sharing and management, privacy, security, ethical dimensions, education, and training. My friend Chuck Friedman, chair of learning health sciences at the University of Michigan, asks this question, though. Okay, big data to knowledge, then what? What do you do with the output of the analytics? How do you feed that output back to the social and human and not just to the physical components of the system? How do you influence the behaviors of healthcare providers, of patients, of institutions in this ecosystem? If you want institutions to share data, you have to look at the motivations of the institutions. You have to look at their liabilities. You have to look at their risks, their value propositions. These are social, economic, and behavioral questions, not principally questions of data, logic, or physics. So the problem that my community is looking at, formulating today, is we really lack scientific and engineering principles to underpin a discipline of design that would enable us to reliably and affordably develop, like learning health systems, systems that integrate computing with human and social phenomena at all kinds of scale in many domains, including health and healthcare, with justifiable confidence that the resulting systems will deliver value to citizens, enterprises, and society. And we've learned to integrate computing with physics. Now it's time to really look at this question of integrating computing with human and social systems. Some of the challenges are listed here, and I'll address each of these just very briefly. So whereas a cyber-physical system controls a passive physical phenomenon for which we typically have a pretty good physics model, a cyber-social system is going to have to interact with people, culture, organizations, institutions. Healthcare delivery, for example, is, I'm speaking to the choir here, obviously intensely human and social activity. It's not just a physical system. So this sort of traditional notion of feedback control doesn't quite work. I mean, a good example of that in healthcare is alerting, right? You detect something, your system says there's a problem, so you send an alert. But everybody knows that these alerts are less effective in many human systems than they are in physical systems, where when you tell the engine to increase the fuel-air mixture, it actually does it. When you alert a healthcare provider, maybe or maybe not. There's a famous example where people were alerted on their cell phones to evacuate the waterfront because a hurricane is coming and it's going to be flooded. What happened? All the people went to the water to see the big waves coming in. You don't know exactly, we don't have good theories for interacting with these systems. So unlike physical systems, social systems of the kind that we now want to influence with computing, they have intentionality. They want things. They have agency, the ability to do things. They have autonomy, emotion, bounded rationality. They have fast thinking, which is non-rational thinking that's just trained deeply in sort of embedded neural networks in the brain. They learn and so adapt to interventions that you make. These organizations and systems have culture. They compete with each other. There are ethical frameworks, laws, regulatory frameworks, incentive systems, enforcement mechanisms. These systems have adaptive capacity that's bounded, but it's there. And so these are the kinds of systems into which we now are integrating computing, often at scale. Some sectors of the economy actually have pretty good models on which to base this. So a nice example is advertising, right? I mean, today they're monitoring the heck out of you. They have better intel on you than you probably have on you. And they're using that to drive your behavior. There's no question about it, right? They're influencing behavior at scale based on validated psychological studies and so on and so forth. In many cases, though, it's very hard to predict the impact of interventions into these systems. These systems are diverse in scale. We're talking about cyber-social systems spanning from individual provider-patient interactions, citizens, their family, their care providers, to care delivery teams, to local healthcare delivery systems, to healthcare delivery ecosystems, to national health and healthcare ecosystems. The HITECH Act envisioned a national health information network that would bring together data from all over the place from which we'd learn. It has partly worked and partly not worked, but that's on the table now. And as we think about health more broadly, we can think beyond healthcare delivery out to food systems, environmental exposures, urban infrastructure, and so on and so forth. If you want to cure diabetes, maybe the right intervention is to re-architect cities in the southern part of our country, for example. And we're moving into a world then of learning systems, and I wanted to just touch on a few aspects of such learning systems. They do, as envisioned in the Institute of Medicine's concept of a learning health system, they do capture and transform operational data into knowledge. So they learn by doing. But they also learn by running experiments. In the software engineering field today, and I'm thinking software engineering sort of at Amazon scale, these companies are running hundreds of experiments all the time to figure out what works. They just don't know what people will respond to. And so they run these multi-arm banded experiments. They're engineered to be fast. Their software is instrumented extensively. They're getting all kinds of telemetry back from the interactions that they're having with you. And they're learning about what works. And so a learning system needs to be able to experiment rapidly and at scale and in systematic and principled ways. Systems like Watson, the strength of these systems are to integrate overall available and validated knowledge. So, you've seen the ads on TV. Watson can read 8 trillion journal articles a second, and, it's going to be bringing together all of this information. So we really are now at a point where we have a good understanding about how to, uh, the different dimensions in which we can build sort of learning systems. But again, where we often fall down today, I think, and my colleagues agree, is that we don't really understand how to drive the results of all of that learning back into these social systems all the way up and down the stack. Again, from individuals to organizations to sectors of the economy and beyond. And it's because it's complicated. It has to do with changing people. How do you make people quit smoking? I had a nice conversation over lunch. It has to do with organizations. How do you get hospitals to share data? It has to do with whole economic sectors, including health and healthcare, agriculture, education, defense. All of these sectors of our economy can become learning systems. And indeed, healthcare has a lot to learn, I think, by looking at this concept of learning systems generalized across sectors. So, you know, if physical models are the key to building cyber-physical systems, what are the kinds of models that we might begin to think about for building cyber-social learning systems? At the top of my diagram, I again have this cartoon of a kind of traditional feedback control loop, but now the system is, let's say, a team of healthcare providers. They're professionals, they're highly educated, they're autonomous, they also have human weaknesses, they get tired. Social things matter to them. Maybe some of them are depressed. We have sensors. We can now sense, as I said before, all kinds of phenomena, including social and human phenomena. I just published a paper called Wide Field Ethnography in which we instrumented a software development team with dozens of GoPro cameras, audio recording, and stored weeks and weeks and weeks worth of data. We can now do analytics on that data and figure out what's going on in that human system. The controller, as in a cyber-physical system, will need to have some kind of model about how interventions will affect that system if you want learning and improvement over time. But a physics-like model is probably not going to work there. So I've made a sort of, first cut at a list of some of the frameworks in terms of which we might think about building system models for purposes of feedback control to human and social systems. And they include cognitive psychology, behavioral economics, which is about how people make decisions in reality as opposed to, utility theory-based fictions, mechanism design, which is the inverse of game theory. If game theory, given the rules, predicts the outcomes, mechanism design asks you what rules do I need to get the outcomes I want. So High-Tech Act, for example, created a incentive system for adoption and meaningful use of EHRs. Again, it's a mechanism, and it did actually drive behavior changes at the ecosystem level. You can quibble with the results, but it's an example of mechanism design. Legal and regulatory frameworks may need to be adjusted. There's a lot of interesting work going on formalization and analysis of human processes. The Mindspace framework in the UK, has anybody heard of this? It's really interesting. This is an effort out of the international development community to understand what kinds of policy changes can influence human behaviors at scale. And so it's rooted largely in behavioral economics, but it's being used to be very intentional about how you drive behavior change at scale, city planning, and so on and so forth. So there are many kinds of social science models that will be critical as we begin to contemplate how in a principled way we can engineer cyber-social learning systems. So the argument that my colleagues and I are making is that cyber-social learning systems really are next frontier in computing R&D. It's about the integration of cyber-physical computing with human and social systems. We think that all major systems have an opportunity to be transformed into cyber-social learning systems, including but not limited to health and healthcare. And just as cyber-physical systems technologies are meant to radically improve physical system function and performance, as with that health surgical robot, cyber-social learning systems have an explicit goal of improving the functionality and performance radically and measurably of these human-intensive systems like healthcare delivery. So my friends and I were envisioning that maybe there's a new science of cyber-social learning systems, kind of analogous to that which has enabled the Internet of Things, this science of cyber-physical systems. So I'll give you kind of a brief history of how we got to this notion of cyber-social learning systems and where we're going with it. So in 2013, I participated in a workshop with Chuck Friedman on learning health systems. This was an NSF-sponsored workshop, resulted in one of the 10 most read articles in the Journal of the American Medical Informatics Association in 2014, called Toward a Science of Learning Systems, a research agenda for the high-functioning learning health system. But at the end of this article, we envisioned that the concept generalizes across sectors. The agenda, very briefly put, the research agenda was that such systems need to be trusted and valued by all stakeholders. They need to be economically sustainable and governable. They need to be adaptive, self-improving, stable, responsive, certifiable in a safety sense, for example, and responsive. And they need to engender virtuous cycles of health improvement. As a step along the way, we have just recently, again, Chuck Friedman and I, Jonathan Silverstein and Brendan Delaney from the UK have established a Journal of Learning Health Systems. This is a widely open access journal with a joint computer science and health informatics editorial board. Really first-rate people, right? For too long, health informatics and computer sciences have been connected by fairly tenuous bridges, and this is part of an effort to bring these communities together, and in particular to enable the computer science community to engage fully and deeply with the health informatics community and with other communities who are looking to build learning health systems. So the first issue of this journal is now in preparation and should hit the streets pretty soon. Again, it's an open access online journal, so everything that appears will be instantly available. In January 2015, motivated by the following observation, we ran a second NSF workshop. The observation was the computer science community would do really well to engage with learning health systems community and others, but we don't have the funding to do that. NIH funds health stuff. They won't fund stuff to do with computers. The NSF funds computer stuff. They won't fund anything with the word health in it. And so this needs to be addressed. So Chuck and I organized this NSF 2015 workshop with CS and Learning Health Systems community to understand how we could enable the CS community to engage deeply. To make the story not too much longer, we decided to go to the NSF, which we did, and they sent us to the Computing Community Consortium. This is an organization that speaks to the Office of Science and Technology Policy at the White House, and it's where the computer science research community goes when it wants to put new ideas and priorities on the table. So we're now engaging with the CCC. We're going to run a series of 3 visioning workshops in the fall and into the winter on cyber-social learning systems. And the way we've structured it is a cross-cutting science with key players from each of 3 domains, including health and healthcare. So Chuck Friedman, Jonathan Silverstein, Bill Stead, and others are on the organizing committee for these workshops in the healthcare space. I will say that the CCC was instrumental, the Computing Community Consortium, in establishing national priorities in cyber-physical systems, in robotics, and in other areas. So this is an activity with potential for impact. The kinds of questions that we're going to be asking at this workshop are what are the generalized principles for design and operation, governance, and so on and so forth of cyber-social learning systems, and how do those principles specialize into domains like health and healthcare delivery. We need detailed and compelling examples of cyber-social learning systems. We need to ground and validate these sort of abstract concepts in challenges in sectors such as health and healthcare. We will be producing a research agenda, and we'll be working really hard to engage with sectors. I mean, as computer scientists, we like to say, you know, we solve general purpose problems, but today we all recognize, and this is coming straight out of the White House, that it's now time for CS really to engage deeply with domains, because that's where many of the interesting as well as important problems are. We'll be looking to define capabilities that we can produce in a 1 to 3 to 5 year time frame, and to formulate and communicate a programmatic vision for the NSF and for other agencies. And for this community, I would say, you know, one of the key questions is how do we build experimental test beds in the domains, in the domain of healthcare delivery, for example, where we can anneal all of the requisite disciplines to really take on this problem of sort of end-to-end design and operation and validation of cyber-social learning systems and technologies. I have 1 minute, so let me cover one of three sort of questions that I think will give you an example of the kinds of questions that this community might be looking at. Today, social and economic conditions impose limits on what can be computed. If you want to compute exactly the number of people in the United States that have been diagnosed with diabetic polyneuropathy, for example, you just can't do it today. I would postulate that you can't do it. You just can't access all that data. You can't access all that data, not just because the cyber infrastructure isn't there, but because the social and economic conditions aren't there to enable you to get at all of that data. So these limits are as significant as those imposed by the physics of computing devices. So the question is, what are the cyber social learning systems interventions that will create social and economic conditions, mechanisms, for example, mechanism designs, sufficient to drive the emergence of data sharing at scale? Maybe there are technical innovations, changes in policy, changes in law, changes in HIPAA. You know, who knows what they are. But those are the kinds of issues that need to be dealt with now if we want to build systems that actually compute answers to the questions that we really want answered. We'll be looking at defining cyber social learning system architectures and really re-envisioning what computation is, because it's not just computers that compute. It's these networks of people and machines and interacting organizations, and those are the systems that answer the questions that really need to be answered. So we've seen twin revolutions in computing over the last decade or so in cyber physical systems and big data analytics, but neither closes the loop with human and social systems. This concept of cyber social learning systems is meant to help us begin to close the loop, and the learning health system will be a cyber social learning system, or actually a fractal and recursive system of systems of systems of learning. So we're now defining a national agenda for cyber social learning systems R&D, and boy, I would be so pleased and honored to have people in this room interested in what we're doing.